Hi everybody. Today I'm presenting the gross anatomy of the tongue along with its few clinical importance. As we all know, the tongue is a muscular organ situated in the floor of the mouth, and it is associated with many functions. Number one, taste, speech, chewing, deglutition, and cleansing of mouth. So it involves many functions. So let us see what are these parts. So it's a highly movable organ. So it has got three parts: a root, a tip, and a body. So body have upper surface, which is known as dorsum of the tongue, and an inferior surface. So that is the ventral surface. The dorsum is divided into oral and pharyngeal parts by V-shaped sulcus terminalis. The inferior surface is confined to the oral part only. So though the tongue is situated in the mouth or oral cavity, so partly it is extended into the pharynx as well. So the dorsum of the tongue is convex in all directions, and it is further divided into three parts: the oral part, which consists of papillae, so it's called papillary part, and a pharyngeal part, or posterior one-third, a faint V-shaped groove, the sulcus terminalis, demarcate the oral and pharyngeal part. So which is consists of number of lymphoid tissue, so which constitute the lingual tonsil. The small posteriormost part, it is continuation of the pharyngeal part. Here you can see the dorsum of this tongue is further divided into oral part by means of sulcus terminalis, and this is the lymphoid, the pharyngeal part, where it contains number of lymphoid follicles. The papillae present in the oral part. There are different types. 4 types are present. The number one, valid or circumvalid papillae. They are large in size, 1 to 2 millimeter in diameter and about 8 to 12 in number. So you can see here, and they're arranged in one row just anterior to the sulcus terminalis. Then the fungiform papillae are numerous near the tip and margins. Here you can see that. So these are fungiform papillae. And third one is the filiform papillae, more on the dorsum of the tongue. There are very few mucosal folds on the sides, very few in number. That is called foliate papillae. So the structure of this papillae appears. So this is the circumvalid papillae, where you can see the taste buds, and fungiform papillae, where also you can see the taste buds. Then filiform papillae, so it is a conical in shape with the keratin covering. Now, as it is said, the tongue is a muscular organ. It is made up of completely the skeletal muscles covered by the mucous membrane. And this mucous membrane contains the projections, which is known as papillae. So as far as the muscles are concerned, there are 2 types of muscles. One is intrinsic muscles, and another is extrinsic muscles. So intrinsic muscles, they are confined to the tongue itself, whereas extrinsic muscles, They're attached to the surrounding bones. And another important thing, the intrinsic muscles, when they contract, they change the shape of the tongue, whereas the extrinsic muscles, when they act, they change the position of the tongue. So now the intrinsic muscles, they're named according to their direction, so that you have longitudinal, both superior and inferior, transverse and vertical, and each side. So this is on each side of the tongue. Now, this is the genioglossus muscle, one of the extrinsic muscle, which forms the most important muscle as far as the tongue is concerned, and which forms the bulk of the tongue. Now, the artery supplying to the tongue, it is named as lingual artery. It is tortuous. In addition to that, so the tonsillar branch of facial artery also supply the tongue. However, the venous drainage of the tongue is slightly different in that there are two venae committents accompany the lingual artery, and one venae committent accompany the hypoglossal nerve. So the deep lingual vein is the largest and principal vein of the tongue. So these veins unite at the posterior border of the hyoglossus muscle to form the lingual vein, so accompanying the lingual artery, so which ends in the internal jugular vein. So this diagram to show that the lingual artery, the branch of external carotid artery, so you can see that it is highly tortuous as it reaches the tongue. So the tongue is important as far as the clinical aspect is concerned, because the understanding of lymphatic drainage of the tongue is very important. So it's further divided into the different parts. So you can see the tip of the tongue, the lymph drains into submental group of lymph nodes unilaterally. The dorsum of the tongue rest, okay, drains to these submandibular group of lymph nodes, as well as posterior 1/3, which drains into the deep cervical group of lymph nodes bilaterally. Finally, all this lymph opens into a group of deep cervical lymph node known as jugulo-omohyoid lymph node, which is considered as, so this is a jugulo-omohyoid group of lymph node, which is present along the internal jugular vein in relation to the omohyoid muscles, okay, the intermediate tendon of omohyoid muscles. That's why it is named as jugulo-omohyoid group of lymph nodes. So this is called the lymph node of the tongue. Now coming to the nerve supply of the tongue. So it's a muscular organ, so it has a muscle, so which require the motor supply. So all the muscles, both intrinsic and extrinsic, it's supplied by the hypoglossal nerve. So it is the 12th cranial nerve, except the palatoglossus, which is supplied by vago-accessory complex. So that is as far as the motor is concerned. As far as sensory is concerned, so the anterior 1/3 and posterior 1/3 and posterior most have different nerve supply. So as for the general sensation of anterior 1/3, it is through the lingual nerve, branch of mandibular nerve. As far as the taste sensation, gustatory, it is through the chordotympanoid nerve, branch of facial nerve, except the circumvallate papillae. So the anterior 1/3, two nerves, lingual and chordotympanoid nerve, except the circumvallate papillae. So coming to the posterior 1/3, both general sensation and taste carried by the glossopharyngeal nerve plus the circumvallate papillae. Whereas posteriormost part, that is the root, which is both general and taste, is through the internal laryngeal nerve, the branch of the vagus. Now, the three different parts, the anterior two-third, posterior one-third, and posteriormost part, including vallecula. So they are different in all aspects. The situation, structure, function, its sensory nerve, and the development also, right? So this chart explains the difference between the three parts. So as you know, the oral part, the anterior two-third, lies in the mouth, posterior one-third in the oropharynx, posteriormost also in the oropharynx. Structure contains papillae, whereas posterior one-third contain lymphoid tissue. Function is sieving, anterior two-third, whereas posterior one-third and posteriormost involves in during the deglutition. Sensory nerve, already we have seen. So the lingual nerve as well as chordotympanoid nerve, special sensory and general sensory. Special sensory and general sensory. Whereas posterior one-third, glossopharyngeal, both posteriormost, the branch of vagus nerve. Again, developmentally, all the three parts are different. The anterior two-third develops from the lingual swellings, as well as is a first arch derivative, and also from tuberculum impar. Posterior one-third from large ventral part of the hypobronchial eminence, that is from third arch. Then posteriormost part, it is from fourth arch, which forms the small dorsal part of the hypobronchial eminence. So coming to the clinical aspect of the tongue. So it is a carcinoma of the tongue is quite common. The affected side of the tongue is removed surgically. All the deep cervical lymph nodes are also removed. So to understand this, so one has to have the knowledge of the lymphatic drainage of the tongue. Now, as all of you know that the sorbitrate is taken sublingually for immediate relief from angina pectoris. So it is because it is absorbed fast because of the rich blood supply of the tongue and bypassing the portal circulations. As I mentioned, the genioglossus, one of the extrinsic muscle, is the only muscle of the tongue which protrude it forwards. So it is used for testing the integrity of the hypoglossal nerve. If hypoglossal nerve of right side is paralyzed, the tongue on protrusion will deviate to the right side. Normal left genioglossus will pull the base to the left side and the apex. So here you can see that the effect of paralysis of the hypoglossal nerve on the right side, so that the tongue deviates on the right side. Because the left one is intact, so it protrudes the tongue. Now this is the paralysis of the muscles, that is the genioglossus. So that is the end of my presentation. Thank you very much.